Yate Bene, Vice President Liza here, along with President Jonathan Nez and our esteemed healthcare cast here from the Navajo Nation. Thank you for joining us. Yate Bene. It is March 1. It is a new month, so welcome to March. The winds will start a howling here pretty soon, and the spring and the budding and the greenery all breaking forth here real soon. So again, here we are, March 1, a rendition of our COVID-19 Town Hall update. Again, thank you for joining us. And as we always do, we open up with prayer. So today we will do the same. So if you would indulge me, and God, only God, we thank you Lord, for another day of life, another day to bring about change here on the Navajo Nation to help mitigate the virus, Lord. So we pray for your protection. We pray for your provision, your power, and your honor, Lord, to be bestowed upon the land. So it's all about the land. Our people have dwelled and relied on the land for many generations. It's for healing to come upon the land. In Jesus' name, forgive us of our sins. Forgive us for all our trespasses, Lord. We forgive others, Lord. And we thank you, Lord, that you love your people. And we do wish to return the admiration that families, our loved ones, our jobs, our communities, and just thank you for all things that you've given to us, our gifts and our talents. God. Now be with us during this time on this call, on this update call for the people, that they may be blessed with the new information, with the data, and they just be updated. And it's good to be transparent and to be passing along vital information as it changes. Be with us in this time. Help us as leadership, Lord, to use wisdom, your great wisdom, Lord, and knowledge that we've attained to this point, Lord, it benefit the great Navajo Nation, this land that you set us here. We're still here. Prayers are powerful. So we thank you again. Yes, in God, Jesus' name, I pray. So there we have it again. It is March 1, and we have our President Jonathan Nez waiting in the wings. Sir, take it away.
Vice President na do here citizen ha behind zigi do are tani hinalki here na zunago do yegon hinan shidalla di kusinskagi na hast eitzata bije balia tashin ya do hot da huit da shin wins bije balia akonde jo zel in ya kon ila bije do to hashit $8,000 di nasni hadon ni jo kon nicht not ani dan linigi do nicht zel in dan linigi dene etchebel beda haznigi nicht ol jo bel kli benach kon bije balia de kosinskagi na hast eitzata jo $8,000 koje zel in dan linigi dano jo benina na hast eitzata hagi chose in dini hil ya ishnigi di kadena kinacha le April 2020 na kitamilia jdoba na din yizlenta kwani hil ya ishni navikia pakha kuna Arobati hi krikodo anilsko le zel in dan linigi bitlande itle ti kot ya ni keni hinna hanna bichu kodol nisto ado benach di de kosinskagi do yego dadol kilta no hat beniya lahande itle so benach the morgan the more na atle hon na kijinda an shona di ya lahande itle sashi ya atahat ne the Kosinskagi Nachekutza do Nanash Doctor Nansen Shinsha Akonde Tonandeya Ade Blush like Kid Hatinigi La Ade Nanas no Banahon Ebenina Ani Hikong the Nebukia Puka okay we tinigi ya Nihize Don Hichi Tit today inigi bikidas hit dollars hot dollars that no abehas Ania Ahandi Hallon Shikena Thini Ashkonish Keno Thini di Chudas Kujiyo Toha Zoji large dasutagi Tiladain Linigi Donat Anidan Linigi di Mass Chudayos Ene Nachikudayilla behas Ani Mhe ya Atoye Kane Atoye Dibi Chini Kata Dinas Nigi di no Ebenina Achudas and Shikeno Thini Ado la ekon ki keni hidna bada ast he is hijedet Washington there ya masan hi chen hinala he dan hidi nido le chun he nkhada ast la kodo ninde khegi la ato bada atse la nada ni tsno de ne ya masani ki chen nala shido abda okadan so ahot yiltkilla ada holya shalchen so keshnal keshi daniki doni ji atilne azze chudel ego azze nakhada az sego jadid kusintsragi nast tapikijna an short ashiken flini la ikon hi masani hi chain nalbada ast bilbeda hazan kon ada huilya hatnigi antin so di nas nahat aiti ba hehnasan kenathlini awashi ni ya des kidne bikia kado benago di de kusinskagi natlnigi inde hada einotlen dadine shati ashlastra inde zedeta adita ya des kid bichini kha da no da yada tiende lego yen di omicron let's say delta will yagi bits ado naslni do di kusinskagi nast dato omicron nana nana liago ado to dago dati wonle shladin ha hot zogo di naslni ado nihido chande kaido oden del nishbilagana bikiyat klode do de kaido nihal chindo alo da altkha ado shin le klode bilagana bikiyat bedol nagi nakhanat zai khod de nabikiyat khad da nadi lwat la kon hi keni hinna di bedolna tatil wadigi ebinna yego de deskit alla ande zedenta ado bennache ya kon nakhada as segi bennache dolla kon hi keni hinna zel in da stradan da hedan hidi nido le mado je masan nalu nutlenigi kodoni hi keni hinna je ashna dalla نخادا أتسي شالشين دو ننجي وحيه دي زيجي يا بكيجنا النشوة بنينا دي يجو تدسكيلي يارو الله أكون يكيني هنا زيل إن ده هاز تخاندان ده دو بعد أزيجي دي يا لا زيل إن ده هاز تخاندان أكون ده بان صدا كيس كلود بالغانا كده هت إنجي بكاجش تيجي تلود كده هت إنجي دو نبي كده هت إنجي لا زيل إن ده هاز تخاندان hada des pendizel in asan des denta nhe khod de nebke yap khad e ashon to la zel in the hast khad jo e brinna de shnigi yesh eno slini e ze na khada az tsegi di bikjna annishigi lan hi keni hinna chudayos in do bada az tsegi e shipinina to la kon hi keni hinna zel in the hast khad and dash kedo shidna da hollia do adobe chini khata di de kosenskagi na hast eitzata ado michel peda hazen an tinkat adena kinacha kui chenti kon ni mask chudal ni zeto ni chip kedas ti kon lego tada do kha o da bilagana bikiya to chanda khigo kon de la mask da si ni the nebikia pokao andin de ni oda so ishi benache edi chudal ashwan dido hand sanitizers that agi donde ni kunshin la ni heda halla edo chudal ashwan dida chidibiye ni heda hallon njon lego gas da inda jikha di kwa chidibisa ya da wala bestol klahi e jodi chostoit inigi nilse ado ado yidigo yadalti di mas aged nigido ado hagan da so trahat na jo au ndel nesh au jo e na antinigi e ya jo ado nalia ba hagan goda sa je ajenda khay jo sa asa at moda chianta hasni piga hot e ya do in lego okay with nada ado ni hid nada so sa e tawshin bil peda hazan da di da to na oi kontra da kha tashi do khosigi peda halondan ataso ti eina antinigi da ado shlaguna edi ze ze bikijna annashi di khosin tsagi jo ein gada at se hanani kuich hadi hespeda hazin shkeno thin ebni na adishna dibe has ani da adat agi judla dolla e ya asande itleta nind ani hespeda hazin shkeno thin eda be has ani gilata nache kodon ni shoda asande itleta olle dicho del ego da adasi kon ada huiliago e ya asande itleta olle no kodo ba yelti shkeno thin so da hosia we as I transition into English, I was just telling the Navajo people that we know the protocols for the past 2 years wearing a mask, and if someone says masks don't work, they need to look at the Navajo Nation. The Navajo Nation has had their mask mandate in place for over 2 years. Of course, with the high vaccination rate, we were able to keep our people safe. All right. The last surge, well, let me go back. The surge before this past month, last year, 6 months ago, we saw an increase in cases, and then we saw a steep drop in cases, just like we're seeing now, right? And some states, just as they're doing right now, are lifting mask mandates. They're lifting these protocols, CDC protocols, and they're saying they're making it sound like we're out of the pandemic, but we're not. And look at what happened last time. We got hit with the biggest surge that we've gone through throughout this whole pandemic with Delta and Omicron. The highest percentage of people who got COVID. And it happened here on the Navajo Nation as well. But you know what was different was we were vaccinated more than many places throughout the United States, maybe even in the world, at 75% first and second shots. Boosters are getting done now, and many people are getting boosted. And it's because of that. Yes, we did go through a big surge. People were caught the virus even though they got vaccinated. But check this out. Comparing our hospital usage on our Navajo Nation hospitals, and comparing that to off nation, we saw a very low minimal amount of our Navajo people ending up in the hospital compared to off the nation. Why? It's because of the protocols that we put in place and the vaccination rate. We are a case study. We are a model. Just imagine if everybody did the same thing throughout this country, we would probably have been out of this pandemic. And that's what the Navajo Nation has to deal with. You know, just recently, New Mexico took their mask mandate off. We on the Navajo Nation continue to wear our masks because we're not out of this pandemic yet. And we're being cautious. It's not about our freedoms, or it's not about wearing a mask or forcing us to wear masks or things like that. It's about our family members. It's about our community. It's about our nation. That's the worldview that Indigenous people have. It's not about individual freedoms. It's about protecting our own. And I want to say thank you to everyone out there. And because of you, we managed to get through that surge. The Omicron variant is out there. There's a new variant or a new offspring of Omicron that's out there. So we've got to keep our guard up and to also continue to get vaccinated. You know, we got the first and second shots over 75% of our people. We got boosters, third shots that are being taken, and then by our citizens now. And at some point, there's going to be a fourth shot, fourth booster, I guess, for those most vulnerable population, those that want it, because the efficacy of these shots is about 6 months. We've been in this pandemic for 2 years now, almost. So it's important for all of us to keep our guard up. And if you look at the first slide there, it's just an update. It's an update of what we've been through since day one. Day one shows the increase in cases, how many people have been who caught the virus, who have recovered. If you look at it there, total confirmed case 52,431. Now we're going into a whole new era where people are catching it twice now, and that's what's being factored into this too. At some point, we're going to have to change our reporting. But we all know 1,648 people have lost their lives to COVID, and our thoughts and prayers go out to them. Yesterday, the report stated that we had 0 deaths and 29 new cases. Remember, we're only reporting on Monday through Friday now, because states are now reporting, some states are only reporting 1 time a week. So that affects our reporting as well. And we also want to make sure that our Navajo people, those that had appointments. Maybe they needed an operation that wasn't COVID related that have been postponed for 2 years now. We need to start taking care of those individuals in the hospitals, non-COVID related procedures. And that's why some of the vaccination events have slowed down. Reporting has slowed down because we need those healthcare professionals to start looking at non-COVID related procedures. If you go to the second slide, it just shows you the last 14 days. It's thanks to God that we're able to see some very low numbers. You know, we had 14 days, 29. I think the highest was at 83, and yesterday 29. And you can see that very low. So by looking at the graph, you're thinking right now, like, man, well, looks like we're getting out of COVID, but we got to keep our guard up. I don't know what's happening on the other side of the world. I know on the other side of the world, they're saying that there's a new wave headed. We just got to monitor those things. Continue to get vaccinated as well. And the last slide I want to show you is the progression throughout these almost 24 months of COVID-19. Look at those waves. When I say wave or the surges, is to increase these. If you look at the graph, they're the increases, the hills there. You know, the first hill was just a little bit, right around June 1st of 2020. And then we thought we're out of it, and boom, look at what happened in December of 2020 during the holidays. Man, we got hit hard. And then through April, June, and July, we saw very low cases. I think that's where people thought, man, we're out of it. But we kept our procedures in place, our protocols in place. And then you can start seeing the gradual increase in August, October, December, and then boom. We did so well during the holidays, ladies and gentlemen. Look at that. Very low. And then I think we either let down, because look at right around right after January, boom, that was the highest surge throughout this whole pandemic. That's the Delta and the Omicron. And we're back down to the low point. Lessons learned here, just continue to keep safe, stay the course, ladies and gentlemen. Mask mandates are still required here on the Navajo Nation. And I know that there's planning of fairs and all that, you know, and we're going to monitor those things. But we all know what to do. Wear our masks. Reevaluating our chapter gatherings, things like that. Some we can do very safely, I think. You know, and we appreciate everybody for doing what they can for people. And I don't know how many tests I've gone through. You know, every time we go down to the valley for an event, we were down in the valley. Before we come back, we get tested. Our staff and our team, just to keep everybody safe, you know. And we congratulate the Lady Cougars of Rock Point, Arizona, for bringing the 1A state tournament title back. We also congratulate the Chinle Wildcats, coming runner-up. Great job all the way to the end. Last evening, we congratulate the Flagstaff Lady Eagles, runner-up again, and all the teams out there. And of course, we know that they represented their communities well. And I'll end with this. You know how much they represented, and I'm proud of all the student athletes from the Navajo Nation and our Navajo people. They wore their mask in the games. They didn't have to, but they chose to wear their mask to set a standard, to be a role model for all of us in the state. And they represented us very well down in Phoenix, Arizona. Everybody wearing masks. doing their job to stay safe. And we can start transitioning, but we got to do it safely. So thank you so much. God bless you. I'm going to turn the time over to our Vice President here for updates as well. Take care of yourself. Continue to wear a mask. God bless you. God bless our great Navajo Nation. Vice President Lizer.
Yes, sir. Thank you. Thank you, sir, for your segment. Thank you for your leadership. Yat Ea Ben, Vice President Liza here. And Chimis Let's Hanabas Chin, Chitashi, Clash Desinelli. It's good to be with you all here again. Again, March 1st. Wow, new month. See long lines over at the bank getting their hardship assistance checks. So please be safe while you're doing that. I see long lines, people standing in lines. Not only that, it's also the state playoffs. Arizona, as you heard President said, and also New Mexico just now starting. We attended some of the district games in New Mexico, and now state starts. So please be safe while you're out there and surround us. As I said, we do see a large amount of people with their masks on, but still a lot of people without their masks. As the state of New Mexico has reduced their mask mandate, so we see people starting to, I guess, experience that news and testing the water, so to speak. But you all know yourself, and you go in with full knowledge, and that's what these updates do. We give out all the knowledge and looking at all the latest information. The news releases nationally and regionally and also locally. So we do that. So I will give my segment, my updates, and then we also have Dr. Jill Jim waiting to will be given her report from Executive Directorship of the Department of Health. So appreciate her leadership as well. So right now, as we look at it, again, it is March 1. The latest news here nationally. Oh, first and foremost, we do have a conflict out over the big pond over there, over Russia and Ukraine, right? And you see the news reporting on it. And so our continued prayers for not only Ukraine, but Russia and for all those that are involved. Nobody likes war. War is not, war is deadly. War is very harmful to the environment, very harmful to the economic viability of a nation, of a country, of a region. So we see it all playing out in last war, and yet we're in a time of our age here, creation. God, God says that there will be wars and rumors of wars, and pestilences and famines and droughts. And I'm here to alert us all, it's tied to the land, the inhabitants of the land, sin in the land. So we all want to live our best life. We all love our families. And that's why we're trying to take them wearing masks and doing vaccines and the like in this pandemic. But it certainly plays into the spiritual aspect, which I know you all are fully, acknowledging the prayers, and we all have different faiths. And, our Creator, God, set us here on this continent, North America, Turtle Island, however you designate it and hold it for yourself. We are still here as a people, notwithstanding all of the atrocities that have happened. We don't wish to eliminate any. We're still here, for me, as this vice president, I'm thankful, grateful that my lineage has been, granted grace, favor, mercy over the time this lineage has gotten to me. To that, our Creator God set us here on this continent. You're still here. Our prayers are powerful, and so we're walking into a new realm of authority in the land, being the host people of the land. This new authority will. Creator God is a God of order, and so once authority is recognized and attained, I believe blessings flow as our Creator God commands the blessings in our lives and our family, but also the government being on the soldiers, soldiers, with the shoulder of Jesus Christ, our Savior, and it's alluding to shoulder. It signifies government. So we just passed February 22nd, the year of our Lord 2022. Isaiah 22:22. He has given the key of David, key to the house of David, placed it on his shoulder. So there's something telltale, spiritual promise, blessing to government apparatus, and acknowledging our Creator God, we're given the authority. Another dimension, another way, another realm in His grace and favor. And so we find that upon us. So we pray as leaders for the blessing to come, for God's healing to come to our land. And it's about the land, not necessarily the people. So, but the people are comprised of the land, right? We're all created from the dust of the ground, right? Ashes to ashes, dust to dust. The Bible lays it out for us. So, what I really just want to pray for this nation is that we heal us and heal the land, but we look to our Creator God for all things. And so, as we come through this pandemic, right, He's been one full preeminence. Our worship and our acknowledgement of Him. Be still and know that I am God. And so, I know a lot of the leadership that we, as Lizer, has been enjoying. I'll say enjoying, grace, favor, and mercy during this time, tribulation, trial, the fire of the oven, so to speak, in this pandemic. Our people have been hit so hard, based on our health conditions, those with pre-existing health conditions. We could ask all those questions, get caught up in all the politics of it all, but really, for you and I and the president and all of our nations about staying safe, we mask up. Yes, we mask up. Do we get the vaccine? Yes, we get the vaccine. But we don't manage people. So personal choice. The White House is relaxing its mask mandate right now. It's the news are reporting. President Biden's State of the Union address tonight will be on, according to a memo sent out by staff on Monday. Effective tomorrow, which is today here, they are lifting the requirement for fully vaccinated individuals to wear masks on the White House campus, the memo said. It added some individuals will choose to continue to wear masks to protect themselves, so we must respect those choices. That's a release from the White House. Also, according to the new CDC metrics, about 70% of the U.S. population lives in a place where they no longer need to wear a mask to protect themselves and others. Their calculation is based on three variables: the rates of cases, the new hospital admissions, and hospital capacity. The recommendations apply to everyone, not just those who are vaccinated or who have received the booster shot. And the CDC director, Dr. Rochelle Walensky, said at a briefing Friday that the change reflects that the overall risk of severe disease from COVID is lower because of the widespread immunity provided by vaccines or prior infection, improvements in testing, and accessibility to new treatments. So what we're seeing almost sounds like a contradiction, right? I mean, we could have gotten to herd immunity if everybody got sick, right? But we didn't want none to perish. And because of our health conditions, right? I mean, we saw, again, over 1,600 of our people and much more, almost a million across America, if not over. So it's really been about protecting lives from the get-go. And so what is we as leaders, the messaging that we put out and we've seen play out over time here is about protecting the people, and it's the people of the land and inhabitants. So news in Arizona, total positive cases 22 months into this pandemic, 1,976,890 have tested positive for this virus in a state of over almost 7 million. So not quite half have got the virus, and many more are staying safe, probably wearing masks, probably vaccinated. That's arguable, though. Again, each one to his own, protecting your own. New cases as of yesterday or this morning, 1,638. Even though the numbers are high, we're seeing numbers steeply declining. It's been as high as 12, 15,000 up there, new cases a day. And so now it's down to 1,638. Apache County, a little bit closer to home, 21,820 with 13 new cases. Looking very favorable there. 37,593 is Navajo County with 29 new cases to report. And lastly, rounding out our Tri-County area, Coconino County, 43,023 with 27 new cases to report. There you have it for Arizona. In Colorado, the state of Colorado has the 10th lowest death rate in the country and the most people vaccinated, including the third vaccine dose in kids. Governor Paulus laid out that the Colorado residents may expect, based on vaccination status, individuals who are not fully vaccinated and individuals who are vaccinated but are high risk or immunocompromised. According to Governor Paulus, 91% of Colorado's population were exposed to COVID-19, the virus, through prior infection or as a result in being fully vaccinated. So there you have it, Colorado News. So total numbers, 1,313,779 with 238 new cases to report there in Colorado. So New Mexico News, 7-day positivity rate, 7.8%. Saturday, February 26th, Sunday, February 27th, and Monday, February 28th. Total positive cases were standing at 503,623 with a 3-day weekend total positive count of 680. In San Juan County, 40,139 with 69 new cases in a 3-day weekend. And McKinley County, 25,426 with 31 new cases to report in the last 2 days. So Utah News, rounding out our tri-state area for all of the land, actually quad state area. I just mentioned Colorado, as we do own land in Colorado. Utah Governor Spencer Cox earlier this month called on businesses to lift all mask and vaccine requirements, saying the pandemic has shifted such that individual Utahns need to evaluate their own personal risk. This is what President Nez has stated earlier, to protect ourselves and to live happily ever after. Data from the past 3 days continues to show that vaccines, and especially boosters, decrease the likelihood that someone dies of COVID-19. The health department said unvaccinated people were at 4.8 times greater risk of dying from the coronavirus, 2.4 times more likely to be hospitalized, and were at 2 times greater risk of testing positive compared to people who are vaccinated. Total positive cases in Utah, our northern neighbors, 922,852 with 896 new cases in the last 3 days on their weekend count. San Juan County, a little bit closer to home, there in southeastern Utah, 3,941 total cases, and our own Utah Navajo Health System reporting in at 1,946. So in closing here, if you feel unwell and even if you're unsure if it's COVID-19, you should stay home. That's a no-brainer, right? I mean, that's just common sense. Slowing the spread of the virus means taking those precautions, not only so that you can rest and recover, but the key to keep others safe. And that's what our president was talking about. Personal responsibility again. True Ahwajit's ego, right? Life is in my hands. So we all take sometimes other people's lives in our hands when we spread the disease. Navajo Nation citizens who report symptoms of COVID-19 infections such as fever, cough, shortness of breath, chills, repeated shaking with chills, muscle pain, headache, sore throat, congestion or runny nose, nausea or vomiting, diarrhea and or taste of smell or loss of taste or smell should call their healthcare provider. And so again, these are no-brainers. You all have done this. You all do this regularly. Vaccines have saved many lives and prevented much spread of COVID-19. Unvaccinated people account for the vast majority of hospitalizations and ICU admissions. Getting vaccinated and staying up to date is the best way to protect yourself and others from COVID-19. You know, I guess just something I know it was highly politicized, vaccinated, unvaccinated. I mean, I love both equally. I didn't care if anybody was vaccinated or unvaccinated, and I was around them. Same, as long as I had my mask on, they had their mask on. Much love going on out there these days, and there needs to be more love going out there these days. So if it's time for you to get your booster dose, remember why you got vaccinated for COVID-19 in the first place. You probably still want to keep your part up by keeping your loved ones safe from the virus, and the booster shot is the most effective way to slow its spread. Hand washing is just as important as it is when you learned about as a kid, right? Go wash your hands. And so my staff, they always wash their hands right before eating a meal and after a meal. So it's just habit, you know. We go on here. All pandemics in our history have changed the way society operates. How are you going to operate in your different hands? Living life fully, not only for yourself, but for others, right? The golden rule. To love our God, our Creator, Shajed, being God with all our mind, with all our heart, with all our soul. To love our neighbor as ourself. Those are the two greatest commandments. The rest, I mean, arguable, debatable, right? I mean, aside from the 10 Commandments, obviously, we want to live by those if we want God's blessing. And then get fire insurance, right? Profess Jesus Christ as your Savior. Best fire insurance ever. Just probably going off on a tangent here, but if you wash your hands, if there's ever a moment where you think maybe I should wash my hands, then that's just a sign that you need to do it. So again, we always got these things, right? These are pretty awesome. Some of the CARES dollars probably went to buy this one, or the ARPA dollars went to buy this one. So, and you yourself, please be safe out there. We can stand in line for our ARPA checks and our deposits and cashing those checks. We can stand in line to vote. We can do all these things. And it's just about being a healthy, well-maintained society, operating on all cylinders. And we wish the best for you as you're out there doing that. So thank you. Have a great and safe weekend. Be safe at the basketball games, and be safe out there abroad as you shop for your own food, your clothes, and as you attend these events as well. So yeah, from the office of the Vice President here in my office here. Beautiful day out there. The winds will kick up, and then we'll be complaining that the pollens in the air and the contaminants in the air will be making us sniffle and sneeze, and the allergies will kick up here. So, but it's all seasonal stuff. So may God bless you. Yeah, we appreciate our President's leadership out there abroad, and we look forward to hearing from Dr. Jill Jim right now, our Executive Director from the Navajo Department of Health. We appreciate her so much. Who would have thought, Dr. Jim, that you'd be leading us, the Navajo Nation, through a pandemic, and your leadership has been great and mighty. We appreciate you staying the course. We appreciate all of your investment, your sacrifice. We appreciate your just being Dr. Jill Jim. You are synonymous with the efforts of keeping our people safe. So yeah.
Thank you, Vice President Nadal Akihat, for all that you do in your work and encouraging words to our Navajo people every week, and also President Nez as well, Nadal Akihat, for your leadership, and all the other leaders here on the Navajo Nation for supporting basically the Navajo Health Command's voice and making sure that we make the best decisions that we can for the Navajo people on an ongoing basis, because a lot of this isn't just the decisions of one person or a few people, and it's really requires a large conversation. And I believe the Navajo Nation, we have made our own decisions, and we have expressed our voice, and sometimes it's not in line with national efforts that we feel like might conflict with our own situation here on Navajo. And we've been in this pandemic for a very long time. We know what works for us, and we know what doesn't work for us. And we just need to stay the course and make sure we rely on what has worked. And as President mentioned earlier, we're really going to be working against lifting up the mask mandates, the loosening of the mask mandates. And I think those are we're not ready to lift those yet here until we know for sure that COVID has gone down drastically, which it really hasn't gone down completely where we're comfortable with our numbers yet. And even though if that's the case, I think we've always had our mask mandates as well. And as we continue with the pandemic, I just want to say thank you again. I'm Dr. Jill Jim. I am the Executive Director for Navajo Department of Health, and we are on these calls every week just to remind everyone that are listening that we are still in a pandemic. Nationally, as I mentioned, there are really a lot of restrictions being loosened. Here in the Navajo Nation, we're still on a major disaster declaration, and we are still seeing cases of COVID. So COVID has not gone away, and that's why we all need to take precaution as we're starting the new year, new month, sorry, in March today. I know we have first of the month out there. People are going to be gathering at the border towns, shopping and doing their errands, and just to let you know, I think most of us on the call know that our Navajo people keep their mask on all the time when we go to the border town areas. So I just want to thank all of our citizens and people and relatives, so for following that, the mask recommendations, and especially if you're with your elders out there, the people that we need to protect are still the vulnerable population. Means if these are our elders, um, their immune system is not going to be as strong as someone that's younger, and that's why we really need to protect them. And we want to avoid any hospitalizations, and we continue to say this only because we don't want to overwhelm our healthcare system all of a sudden, because actually it takes a while for, once you loosen restrictions, it takes a couple of weeks, and then all of a sudden you see a lot of cases just because people are roaming around and now getting sick again. And so as numbers go down, we've seen these, we have experienced a couple of surges now. So it might feel good right now that the numbers are low, but it starts kind of going up again when we loosen restrictions and when people feel like, oh, I'm just going to take off my mask and go gather, which is fine. But I know people are protected from this last surge where a lot of people did get sick. But at the same time, I think we need to be careful because as we lose some of that immunity against fighting COVID, we're going to be in the same situation, or we don't want to be in that same situation again too. So it's really unknown. And I think we've talked about that. And I've mentioned that before in the. So I just wanted to remind everyone just to make sure that although we see this outside the Navajo Nation, we still have to take as much precautions as we can, mainly to protect the individuals that we love the most, and that could be our family, our aunts, our uncles, and also individuals that already have health conditions that might really affect their body to defend against COVID. Someone that has cancer or heart disease or diabetes or other health conditions that we have talked about, and those are very prevalent here in the Navajo Nation. So I believe those are some factors that really contributed to our cases early on and through the pandemic. So and when we talk about the health of our Navajo people, I know President Nez has mentioned that before, to really think about eating healthy and exercising. And I think it's very important because a lot of these are silent diseases that we've been battling with. And that means really taking care of ourselves. Last week, I talked about label reading, reading labels when you go to the grocery store, and just a basic tool that you can have to read labels to understand your nutrition intake. And that requires either you might have to just decide on, well, am I eating too much saturated fat, or am I eating a lot of carbs if you're diabetic and you want to control your glucose level? And it's very important because those are things that sometimes we just have forgotten during this pandemic. And sometimes I think that with the pandemic, the stress that we have been under, I think also exacerbates our own physical well-being too. And sometimes you wonder, well, why am I not improving in my health? And stress has a lot to do with it too. And so when we talk about stress, I think the Nick Echo, I think in the Navajo way, I always think about really just taking care of yourself and living yourself for who you are. And that means taking steps to be healthier and exercising. And that really starts with you. And also, I always think of your individual well-being as sort of driving your life and your ability to live healthy. So if you haven't thought about yourself today or yesterday or the day before about doing something good for yourself today, find something that you enjoy doing that maybe you haven't done for yourself in a long time. That means reading a book, taking a walk, calling a friend, or or visiting with someone that you haven't talked to. So those are all good gestures of taking care of yourself. And I think we have to really remind ourselves, and I just want to remind everyone of those important things as we continue to coexist with COVID. It's here, it's not going away, and we're just going to have to remind ourselves that we have the tools to do it. So I won't share anything like the nutrition labels today, but I just wanted to lend some encouraging words to everyone on the call, and thank all the team members on this call as well. So I'm going to hand it over to Captain Johnson. I believe Captain Johnson's on the call. He's also very a critical team member of our health command. So I'm going to go ahead and hand it over. So Captain Johnson, take it away.
Okay, thank you, Dr. Jim. Glad you were able to join today, and I just want to say thank you to everyone here this morning that's been talking on the town hall. I think it's, as we've said throughout this pandemic, just how important the town halls are to make sure that information is being shared in a transparent way to the public. And I think it's very important to get local information. It's always good to hear the national scene and to understand that, but it's also perhaps even more important to hear that local perspective and the facts of what we're seeing on the ground with our local healthcare facilities. Just a few comments today, and I do want to just say hello to everyone across Navajo Nation, Navajo land. It's always enjoy jumping on these town halls and sharing information and listening to the latest reports. Sometimes the information can be repetitive, but I think it's important to sometimes to have some repetition. Sometimes we learn best when we hear messages more than once or twice, and I know that that's been the case along the way. So again, I think this is a critical venue for our local citizens to hear and see. And we know that the Navajo Nation Health Command Operations Center continues to be the forefront in leading the pandemic response here on the Navajo Nation, have served in that central capacity for all of our healthcare facilities and all the public health programs around Navajo Nation. It doesn't matter if you're on the west end or on the east end or north and south. It's what's important is that we're sharing information, and not only here with Big Navajo, but also with the satellite programs as well, which is so critical. We also know that the pandemic has really affected and disproportionately affected American Indians, Alaska Natives. Whenever we compare those to other groups across the country, and we've seen infection rates 3.5 to 4 times higher than some of the other races and categories that we might look at around the country. And these statistics are looked at to compare and try to understand, why do we see a disproportionate impact? And so it's very important for us to understand, and we all know, and we've all known of individuals, our friends, our family members who have become ill throughout the COVID-19 pandemic. We know some that have become severely ill and some who have unfortunately passed. So it has been very impactful to all of us. And I just continue to certainly say my prayers for Navajo people, and certainly looking to the future with lots of hope as we continue to fight against COVID-19. We know that, I always like to take a step back and just mention a little bit about, oftentimes folks may perhaps not been infected during the COVID-19 pandemic. And it's just important to understand. I mean, here we are going into the spring of the season, such as Vice President Leiser mentioned earlier, how the winds will pick up. And so we would anticipate that things like allergens and dust particles will start their annual flight. And oftentimes, as we know in the local area, allergies can be an issue, and many of us are prescribed prescriptions just to deal with those. But it might be possible that individuals could become confused with that, during the spring of the season, spring of the year. What am I feeling here? I've got a runny nose. I've got, I'm feeling tired. And some of these symptoms are consistent with how COVID-19 might onset. And so it's important to understand that. And, typically once you've been exposed, the symptoms can be mild to severe. Of course, we've seen that and have continued to see that. And the symptoms may appear, 2 to 14 days after if you were exposed to a person who was positive. So again, anywhere between 2 and 14 days. Oftentimes, it's around the 5-day mark once you've been exposed to an individual who has COVID-19. So you might experience things like fever and chills, a cough that's pretty persistent. You can be shortness of breath and fatigue, just kind of feeling generally tired, muscle and body aches and headache. Again, one of the sure tell signs of COVID-19 has been loss of taste or smell, and then sore throat, and congestion and runny nose, and nausea, vomiting, and possibly diarrhea. And it's, the runny noses, the congestion, the coughs, and sometimes the fatigue. All of these are consistent with springtime allergies as well. So therefore, my comments about that. During this time of year, if you feel that you are having any of these symptoms and you've got questions, you can always visit one of your local health care facilities to get tested, and we do recommend that. We will continue providing those tests, and we do have schedules out around the various locations here on Navajo. But what I recommend is if you feel like you need to be tested, you want to be tested, then certainly continue coming in. We certainly want to care for our patients and make sure that we're doing everything we can to make you feel a sense of assurity during this time. And I think it's, when we talk about testing, just one fact that I'll share here. As of just a few days ago, when we look around the country with the Indian Health Service, and this includes our 638 partners, over 4.2 million tests have been performed dealing with COVID-19. 4.2 million. That's quite a large number. Pretty impressive around the U.S., including the lower 48 and Alaska. And so it's important to know that testing will continue, and we want our patients certainly to come in and see us if they have any questions. So I do certainly encourage folks to come in if they feel the need. And then also, of course, one of the developments that happened over time was that we focused on testing with home test kits. And those, of course, have been distributed over time. And our hospital and clinics oftentimes do have those available. And we'll continue to distribute some of those test kits in the Indian health system and the tribal operated facilities as well. And so those home test kits can be effective as well. But I just wanted to mention that as the numbers have been substantial over the last 2 years. And I think it's to have that high level understanding. Also, just wanted to mention that, and I just want to make sure everybody understands, because everyone's hearing that, that we're seeing less numbers of COVID-19 across the United States. There are some areas where, the virus and infections have decelerated. In other words, they've reduced. However, there are some areas where the numbers have maintained, and there's some areas where we still have hot spots. And so it's important to understand, I think, as Dr. Jim hinted at in her conversation here today, is that we're still in this. We still know that there is transmission occurring. The picture may be looking a little bit better in terms of the number of cases reducing, but that doesn't mean that we should just ignore those that continue to occur. So what that means is for those prevention tactics and measures that we've suggested over time, those have been demonstrated to work, and we do encourage individuals to continue following those. And we talk about, really good hand washing. We talk about our masks and wearing proper fitted masks. Those are all important at certain venues, and I'll talk about that a little bit more in a moment. But I also just wanted to talk a little bit here, because the best tool that we still have in our toolbox to fight COVID-19 continues to be vaccinations. And, I know that President Nez and Vice President Leiser and Dr. Jill Jim and the Indian Health Service have been very strong supporters of the vaccinations, and also not only the primary vaccinations, but the booster shots. And we continue to encourage folks and advocate for folks to get your vaccinations. It's not too late to do that. Even if you haven't had it yet, had the primary dose, or if you have not had your booster, now's as good a time as any. While I believe President Nez pointed out in his discussion that early on we saw a huge increase whenever we were talking about the Delta variant, and then the cases really dropped down to where we were basically seeing very little to few cases of COVID-19, and then all of a sudden a huge expansion of an increase of cases. And so we have to keep that in mind moving forward. We certainly hope for the best in terms of the pandemic and keeping our numbers, but we also have to make sure that we're doing what we can individual responsibility in doing what we can to protect our friends, our fellow citizens. I think it's important to know that as of the end of February, IHS has administered over 2.2 million doses of COVID vaccine, and also has distributed about 2.8 million doses around the country in Native American country. So we know that over 1 million people have at least one dose. We know that that represents about 51.7%. We also know that right around 854,000 people are fully vaccinated. When we talk about fully vaccinated, the primary vaccine series. So it's, again, just kind of walking through some of these numbers, it's important to understand. I think it's easier said that for when we look at the national scene in terms of Native country, about 56%, 18 years and older, are fully vaccinated. when we look at the 12 to 17-year-old range, about 36% of those. And then in the 5 to 11-year-old range, about 13.7% percent. And so it's really important to understand that we still have a long way to go with our primary vaccinations and our boosters. So even though you may not have gotten yours taken care of at this time, it's really important to continue to pursue that because there is a potential that we'll continue seeing different variants, that we'll see increasing infections at some point in time, and you'll want to be protected should that occur. As we, again, continue to hope for the best, we should also be prepared to deal with what comes our way. So, again, we will continue to promote and administer vaccines. I want folks to know that the supplies are available. Shouldn't never worry about that. And we'll just continue working in that fashion and continuing to share information. And just as a reminder, at this point in the stage of the pandemic, that children from 5 years old all the way up to adults beyond, those are all eligible age groups for COVID, the vaccine, the primary series. So it's important that we all understand that and continue to encourage our friends and family members to get those. So we also know that we continue to do the booster shots. We have the primary series, but also the booster shots. And those booster shots still remain for 12 years old and older. And again, if you have any questions on the booster shots, of course, the primary series needs to be taken first. But talk with your local healthcare provider, contact your facility, reach out and ask what you can do to get your booster vaccine. They'll be happy to help you with that. And so, within the Indian Health Service, we know that we've integrated the COVID-19 boosters just into our routine medical care by screening our patients who are eligible for the boosters. So should you visit your local healthcare provider for other issues, you may be asked about that. Have you had your primary vaccination for COVID-19? Have you had your booster? And if not, they will be happy to provide that for you. Also, we know that we're kind of making our way through flu season, but flu shots are still available, and you can get those together with a COVID-19 vaccination if you so choose. We are getting into the spring of the year, so flu season hopefully we'll be getting past that fairly soon. But I also just wanted to just in closing out here, just remind folks that, when we look around the United States, we do see that the number of COVID-19 cases are generally decelerating or decreasing. However, the main message here is we need to remain steadfast with our prevention efforts. There is nothing wrong with continuing to wear a mask, particularly in public locations. We know that many states have removed their mask mandates, as was shared earlier, and that's a decision. That's an individual decision. Just because there is not a mask mandate doesn't mean that that you shouldn't wear your mask. It means that you have an individual decision to make if you would prefer to wear that and protect yourself. I recently had to go back to my home state of Oklahoma, and during my travels, I did notice the huge populations of individuals who were not wearing masks. I chose to wear mine when I went into public facilities, and I know that that's protecting me during my travels. So, we don't have to follow other individuals. It's an individual decision, and hopefully you'll make the right decision with that. That's just such an important means of preventing COVID-19 transmission and spread. We will continue to hold our vaccination events. We'll continue to provide vaccine in our regular clinics, And it's indifferent if you're visiting an IHS health clinic or hospital, or if you're visiting one of the tribal managed hospitals. All of those will still be providing these services. And we just, again, recommend and encourage folks, if you haven't had yours yet, to continue to do that. It's the best way to fight COVID-19 and assure your safety. Again, mask wearing, we certainly continue to recommend folks wearing masks, particularly in public settings where you're around others. And then when we're talking about indoor environments, it still remains critical. When we talk about outdoor environments, if you're not in close proximity to others, then certainly not wearing a mask is, if you want to go out for a hike or a walk and those kind of settings, that certainly works. But I would still continue to avoid large gatherings, especially indoors. That can still be an issue. So again, I want to thank everyone here today for another town hall session. It could go into much greater detail, but the main message is keep up what we're doing, remain steadfast, remain vigilant in fighting this virus. Don't give the virus an opportunity to raise its head again as we continue to see decreasing cases. We want to do everything we can to suppress it and to where it does not come back again. But please just continue to follow those guidance, those pieces of guidance that are being provided here. So thank you, and I think at this point in time, I'll turn the time over, I believe, to Mr. Dale Yazzie with the Navajo Nation Epicenter. And Dale, whenever you're ready, you can take it away, sir.
All right. Thank you, Captain Johnson. Hello, everyone. Thank you all for joining us. My name is Dell. I'm with the Navajo Epidemiology Center and also our HCOC Unified COVID Epidemiology team. I'm going to do or provide a quick update on our Navajo Nation gating measures, covering a 2-week time period, February 11th through the 24th. And this is our recent cases and trends. It's a 60-day time window showing here. If you focus on the red line, which is our 9-day weighted moving average, as mentioned by my colleagues here, we are seeing less cases currently. This bar here, the highest bar here is was on January 18th. So around that time, so now for about a month and a half, we've been on this downward trend to really where we're seeing about, on average, about 30 to 40 cases a day, which is a good sign. And it's reflected on our 7-day infection rate here at 0.72. Last week was at 0.74, I believe. So it went down a little bit, and that's a good sign. This is our case incidence across Navajo Nation here, just showing spatially by map here. You don't really see any red colors here. So most of the IHS service areas here are in this pinkish or lighter shaded color here for 0 to 199 cases per 100,000 as a 7-day case rate, including Utah, Arizona, and New Mexico. The only service area here with a higher 7-day case rate is Crown Point service area, and our bordering state is also in this orange color is Colorado. So, and then 204 new cases over a 7-day period, which puts our 7-day case rate at 129 cases per 100,000, which is actually still in the red threshold based on our gating matrix for our COVID response on Navajo. Some additional metrics here are lab-based test capacity. 18% our 7-day test positivity rate. This decreased as well from last week. Last week was 24%, so it's a good sign that this continues to decrease. So we're now at, also the average daily tests over 7-day periods about 500. So there is testing still ongoing across the nation. Hospital capacity, bed occupancy for regular hospital beds and ICU beds remain below our threshold of 80%. So that's also a good thing. This is our latest vaccination numbers for Navajo Nation residents only. So Navajo Nation residents completing a primary series is now at 122,364. And then of that, Navajo Nation is up to date, which means they received the booster shot at 81,421. So, and then residents 12 plus years and older, 12 plus years, now 75% are now have completed the primary series. And then residents, all ages, is now 65% who have completed the primary series. So these numbers continue to slowly increase as well as more people are continue to receive their primary series plus the booster. So that's a good thing. This is our epi curves for the entire pandemic. For the blue line is the U.S. Across the U.S. we're also seeing decreasing cases, and it's about 60 to 70,000 cases a day currently. This is their vertical bar axis here for the blue line, 60,000 or 70 cases per day. And then the orange line is Navajo Nation. We're about 30 to 40 cases currently at a 15-day moving average. So it's a good sign we're going down. And then this is our 7-day case rates comparing the Navajo Nation here in the yellow bar to the 50 states and jurisdictions. So we're still we're trending the right way this time around. I believe we're now at 39th position. We went the right way, trended the right way from last week. As you can see, the red bars are the bordering states. And just a reminder, we are still seeing a lot of COVID cases within our region, in our bordering states in New Mexico, Arizona, Colorado, and Utah as well. So, and then our 7-day case rates here, the situation across the U.S. by states. Again, in our region, a lot of COVID cases still occurring. Here, we're starting to see some different colors besides red. This is also a good sign. You see some yellow, some blue, and even some orange. But within our region, all the counties within Navajo Nation is still red, so meaning high COVID transmission. This is the latest numbers for the COVID strain surveillance on Navajo Nation, report 44, which came out yesterday, the 28th. So this, the Omicron variant and its sublineages went from 1301 to 1389. So that's 88 new cases were detected on Navajo or as cumulative. And then the Delta went from, there were 4 new cases detected with the Delta from 1412 to 1416. And then all the other variants remained the same. So. And then this is the CDC variant profile across the United States. And this profile remains the same as well. This is this purple and the lighter shade of purple here, and then the pinkish color here are all Omicron, and the sublineages here. So the BA.1.1 is the purple, making up about 75% of all the variants for Omicron. And then the next one is the B.1.1.529, is this one. And then just want to highlight this BA.2 went from 3% to 8%. So that's a bit of an increase from last week. So we're still keeping an eye out and monitoring this BA.2 on the Navajo Nation. As far as the surveillance on the COVID strain surveillance on Navajo Nation, we have yet to detect a BA2 variant on the Navajo Nation. So that's we're continuing to monitor that. And then this is high-risk chapters profile here. 31 new chapters made the high-risk chapter list. And then this also went down from 54 chapters last week to 31. So that's, again, a good sign. And if you go across, here's the timeline going back to about 6 weeks ago, January 14th. These 16 chapters have been on this high-risk chapter list for at least 6 weeks. Then last, risk level assessment here. We remain in the red threshold, although we're seeing a decrease, but we're still seeing a high number of cases. And lab-based test positivity remains high at 18%. And hospital capacity, as far as beds, remains stable, continue to be below 80%. These are thresholds, so. And last, we remain in the red based on the numbers we're seeing, but we are seeing less numbers. So that's our overall situation on Navajo Nation. And I'm going to stop here and hand it over to Shema. Dr. Fowler, please take it away. Thank you.
Yat shik Bedeutet nicht nacht my deskis ni einschle, aro toricini ibashchin. Kapahanda shichegot ashedationale. What's aholiera are yesicashike. Halane shkedoshne. When he's now no clonido, could another see of gizi here and he schnidole. I'd like to thank all the listeners for tuning in. You know, this is our weekly updates related to COVID-19. السهيشين يادي على لانج دي نشين إيها بتشنيدو له نهي تلاو أدون هي إذا إيش إن دان لني إذا نكاد دان لني أدو إذا الأون اشتدهسني إيشين إلا لانج إيها بدي نيدو له حالا دون هيك إن شهو هو ياد إهو إين خاطها ليا أدون هي نات آني لني إتلتي President, Vice President نهي دو إيها. Thank you for your leadership. And Lini Kojo is it in a raj ajib etelate Lini Nedohiha. Ado apelate Kodet Isano Sai do Hat Akisi. Besh behene Ajna Rajado Leia that need ongo radio station de Lini. Ado and Skag or Hiha radio stations and not Lini. Nick has twin Hizani his kit. Ado Dahwis Ago. Nihi neta dit a ido nihi de ne en lini bel ishtan onosani nihi ihe nihi din nidole. At this time, I'd like to acknowledge all our local radio stations. At the Nick College, KXWR, Alamo, Neto, that is KBR, NTU, KCZY, Ado Kwanitzahotzani, KTNN, Ado Totkate, KND, Indona, and Georgia, KGAK. O you she aden kodet hata akis. Ihed he dishnido le shas twisizan it's a KGK dan nothing. Ebedike enaz go aja. They the be not yedi yo kodon hitch hane edel inido nhapen nada nehi ihe. Ashi ine aho ihe nihidi nidan de kodo ihe nihidi nido le asa anizeno. Ado di the kosna states at dapeti nini. Adna kinach dan doi wata e kujita khil donle halet a e bije dol ni do halet a e kodo be hikati jana kodo stilin lini nihinat a lini kodo yan hasne but a bi khadidi ka e do ni zeno kwa nanish ilia do hashin so na antkin nihin da has la do na antkin lini ho be not need kindo be se na ni zendole hala a ni e do ba at ni e dan e Ado kodo is the benapin has lein to niche. Adon hilnas ango ben at nitkin. A quende dik at the bahasne atone le away chin in the hall. Aja eka is the lini bata has lean. Nakahadal na siya kero siya na eti no kodo pa kwit e ba na ini ka. Ako ze lini nakahadal ya ba he ni zin. Ado atinalto atin jikish. Do siya do na do no zi it ego ko atin jikish kero siya na. Ado di kodo siya ya na hasne Omicron na it's a Delta variant. But abedi no ado Omicron sa ho entol nila. Aleit ada bijit o la johin zeno anant agot ada benach etrahajil na shido kodosa zero yego nationez tato nation tin o konde ba yensen o yugo nationez tato iwe akwa etrahane ibete da hoye la adon hachinin hitoken hinalike ad endeto the neck etche yada hita ladies a ishin e ladies a o konde hajo na notkin hajo apel ishchano inosen hiti na kodo ado dik ayat en da haslido yanal kil yat en da hasliben na hits isen lini be da akolia chian so inido be da akolia etrahazes volyeni do be ben da kas dik ni kita aketa ohona nish nada has after ano na nishin mosleni do Navajo Nation employees in Hidishtina ad and Ansade Hajon Hinat an in Lini Behan so kesa an datle Hala din hidden and Lini Ishi Kajopa in Zeni in Yedo Gas ako an da atleche for deshish Kadna kina hedoi which it ben not need hin dog at Beltadita ado bi tadike ashi in ni dodge enna yin belata has it bekat bin a hot it do belata has it got ashik edo shidne go hashi ni la a telework bidi ne aho wato de ni nish ya the bed zedle kon kin takon hilda ja haslago kan hilda aje jo edo telework ida na ho hundo ni to di ne jo ein hinat anin lini eln dahnesh at na nishko en naho titole jo hini ke hajo be rat no ato at aho ana nishte nada an nishtole jo hot na sos bahan nada liagoda zet ya juna quinten eto a konde be eta akolian shik edo shidne ni hit hodezen lini jo edo arkeda ebe enit eto. We like to continue to providing the virus and variant updates. We do have the vaccine and the booster. We are looking into the second booster. Vaccination is available to all ages, as Captain Johnson had indicated. With the warm weather, we ask that you continue your healthy living with your healthy eating and exercising. To our employees throughout the Navajo Nation, and not just focusing on the Navajo Nation, we are looking at opening all our offices and to make our constituents and our customers happy. It's been over 2 years that we've been educating everyone. We know what to do. We are working toward eliminating the teleworking agreements within our Navajo Nation. We respectfully request that you work with your immediate supervisor in returning to work. We want for you to continue taking precautionary measures by wearing your mask. I'm not wearing my mask today because I'm alone in this office. We ask that you continue your prayer, stay strong, and educate one another. But Ajin Kodoben, Abalagana Etchaben, his Nahas Neto, oh, you na kit nahan at Eshik Edoshin, Kodon is in Ashi in the Etasato, Flattened, the Queen, the Shin, his Nahan now, that became 18. A Kodi, a Tapayaj, Yizikon net, Tatona, Dino, Adi, and Katonet, Kodoshi Yajna has Naigi, a Yego ya deskit. A Koditos, a ginger, a Yego yam deskit. Nikina go to Tina al Kaipeta does not eat at my kidneza Tina and think go kill. It sena is at the media aros tadneza tin tadneza tin doba an. Kade asho yago an nit and kidneza Tina and think. A Kodish Latin Kahot Zoja Nihito Yego Yan Deskit. Argentine Hina go to Yagonal Kiltish Latin has ango. Akodi Omicron bedi nini do variant Delta variant bedi nini lahon ordinarily Aja in hits out the desk nas atino on ki benachet the na desk koshine to go tade de millions on last etingo on not ki akwadini hinago hot atil chi in the alkahi na alkahi don't label that na atil a yeto that the kid quantity is el ebel na has ango don the alkahi llwg sogwn and nal kid asian llwg kodona kapa ahon sindo le na ke hen kidi ni do le ane ta is not sign not that that is not do behs an big at the hot any ikke hen kidi ni do le Nana Kwabananish, I'd like to make an announcement. Our Navajo Nation Office of Vital Records and our Office of Controller will be in Tucson Thursday and Friday of this week, beginning at 9 a.m. and 3 p.m. To assist with the hardship technical assistant will be located at the Arizona Forge at Royce Place, 44 North Stone Avenue in Tucson. Kodoshe di peso, kinal pedech et aninki latope ka ayedi. Naka-achinin nihitoken hinalike dan lini dan sounded ke da hatidon da nish okodi Tucson horyete hos dodon which a belaja aj e kona de kedole e ad aka ayedon sos hatatel nei aro di yese pohol nihi na sos pohol nihi bedi nini e best ACIB de e ad e yaben yahanada oklehashino lanshi ad ke da hatido don khatabi gahoben na Aj de Kedole, the Arizona Forge at Roy's Place the Hutne, the Enas Adol Nink Ado Tad J is Chittens or Nink the model, then Chicken that don't lay that in Nishkon Ad de Kedole, Adon Hizad, Lini Ashonde, but the Yando Altonevich Hata Inosne, Hala an he ebe etaso, Titi, Nako. But Ashe Kodon hit nata hasid net doleshik Edo should ne Yego Tata Yado Nago Tahata of seed Nihizad Lini Yo o net back at that hit. But a Kodohan and linen hitch and na nail yadole. Na he had on Jono Niheta a gone.